Good evening. Tonight on Women, we're going to be discussing women and psychology. We have with us this evening Dr. Joanne Evans Gardner, a physiological psychologist. She's currently a politician in the Allegheny County Home Rule Study Commission, and she is a former board member of the National Organization for Women and the Women's Political Caucus. Wow. Joanne, I'd like to ask you, first of all, off the bat, what percentage in the professions of psychology and psychiatry are women analysts, therapists, and clinicians?
Well, women, the medical discipline of psychiatry has one of the highest proportions of women of any of the disciplines, the subsets in medicine. In psychology, the membership in the major professional association is thought to be about 25%. So there are substantial numbers of women who are professionally trained in these areas.
Now, you're a physiological psychologist.
Yes.
How did you get into this field? Why did you choose this particular field?
Well, I didn't realize it at the time. It's the most exciting field. It's the field at which many breakthroughs are being made, and it's one of the most prestigious of the fields in psychology.
It's also the most male-dominated.
Yes, it has the smallest proportion of women who are trained and active of any of the fields.
So that's
it was
quite
a bad choice.
Success.
Yes. Well, one of the reasons I'm in the women's liberation movement is because I could not make it in that field, and that's a tragedy for me.
Well, now, in comparison with other fields of medicine, there's quite a decent representation of women in this field.
Well,
is
in psychiatry?
In psychiatry.
Well, it isn't very good. It's something on the order of 12%, I think.
Right,
but relative to, say, gynecology,
right, yes.
or surgery, or some of those other fields, it's very
well, how would you evaluate it? Is there equal job opportunities, or more of an equal job opportunity, or is it just that women have greater motivation to get into this field?
Psychiatry is a low prestige field in medicine, which many people don't realize because they pay through the nose for psychiatric services. But in fact, it's a very difficult field and a very painful field for people to sit and listen to other people's emotional pain for hours on end, which psychiatry requires. That is, analysis and therapy is it's not a high prestige thing.
That's interesting.
In the medical profession,
it
is my impression that psychiatry is on the low end of the prestige field. Now, in psychology, the experimental psychologists think that they have more status than clinical psychologists, but I suspect it goes the other way if you happen to be a clinical psychologist.
Yes. Well, I'm surprised to a lay person, you know, I would never have thought this. I'd like to ask you a question on the other side of the coin. Approximately, I'm sure it's difficult to say exactly, but what percentage of patients in America are female?
That is, persons who seek help for emotional pain.
Or are institutionalized, or so on.
Well, Phyllis Chesler was one of the first people to really go into this very carefully, and she concludes that women far outnumber males in all kinds of psychiatric and therapy, mental health therapy situations.
Now, what conclusions do you draw from this? One might almost imagine that there are certain psychoses or disorders which are uniquely female by this statistic.
I think that's probably true. Jessie Bernard, who's a very famous sociologist and who has made a profession of that, her professional interest has been marriage, concludes in her book Women in the Public Interest and another book that she wrote called The Future of Marriage that marriage drives women crazy. She compares the man's marriage and the woman's marriage, and she makes the point that marriage for a man is a very good deal in terms of his psychological health and so on. For a woman, it is not. Single men have a higher rate of mental illness than married men, but single women have a lower rate of mental health problems than married women.
Well, when you're talking about mental health problems, which women suffer from, now what are you talking about? Things like depression, psychosomatic illnesses, or
anything that drives a woman to seek professional help because of a quote emotional problem comes under that category of a mental health problem. And for some women, it might simply be the feeling that life was not allowing them a normal amount of satisfaction. Just a feeling of dissatisfaction. For other women, it might be a fear that they were going to commit suicide or perhaps murder or whatever. People have recognized for a long time that there tended to be many more women in analysis and in therapy than men, and one of the explanations for that was that it's more proper in our society for a woman to admit that she needs help. It's part of the traditional training of women for them to seek help. Doctors in medical professions, that is physical, non-mental health problems, have also noticed that they have more women patients, and they have concluded, male doctors have concluded, that this is because it is okay for a woman to say she's in pain. And it's not proper for a man to say that, and they think that's one of the reasons women seek medical help of all kind more readily.
Did you find that women take the last recourse, that of suicide, also more readily than men? Well, particularly married women?
One of the frightening statistics for me to realize is that women characteristically more often attempt suicide than men, although they're not usually as successful. And there have been many explanations for why that might be. But in fact, women are getting better at it, and the rate of successful suicides in women has increased very drastically. And I find that a very tragic thing.
That is so, yeah.
Yeah, they're learning how to do it.
Whereas before it was just
oftentimes they didn't succeed.
Yes.
And psychiatrists, in fact, said it was because they didn't really want to succeed. They just wanted to call attention to themselves. And that may or may not be the case. There are so many statements made about women for which there is no better evidence than somebody's clinical observations. And I don't know whether it's obvious, but a clinical observation means that a doctor or some other person in a helping profession has observed this to happen, but has not done a systematic scientific study. And what that means is that they have not looked to see whether the converse might be true. In a scientific study, an experimental psychologist always attempts to show not that a hypothesis is necessarily true, but that it could be untrue. They test what's called the null hypothesis. Put it another way, suppose I believe that women's rejecting of children causes children to become schizophrenic. I would not accept that hypothesis until I investigated also the converse and allowed it to become true, if it is true, which is that there is something about the children that are schizophrenic that causes the mother to reject them. Now, clinicians typically do not take care to have those kinds of controls on their studies. And so when they say, well, the reason women didn't succeed in a suicide attempt, the reason they didn't succeed was because they didn't want to, they're basing that on an unsystematic study, on impressions rather than on science.
I read a study, how scientific it was, I don't know, on suicide a little while ago, which said that 75% of the women that attempt to commit suicide do so in the week before menstruation takes place. Which brings me to another point. A certain while ago, a certain gentleman made charges to the effect, yes, that women undergo raging hormonal imbalances at the time of menstruation. Now, do you think this statistic in any way gives credence to this observation?
I think doctors for a long time have used the fact that women's bodies are organized in a cyclic way during the period when they bear children to explain many other things. And have not looked for any other kinds of explanations. We are only just now beginning to look at cyclic changes in men, which are more subtle, but potentially just as effective. And by looking at both sexes with the same question and with the same kinds of controls so that we don't come to incorrect conclusions, we're finding many things. I do think that women, in fact, because they are experiencing different physiological feelings and have been trained to expect to feel differently, may very well be more likely to be depressed at certain periods than at other periods. There's no way to tell whether it's because they expect to be or they really are.
Right. Back to something you were saying earlier about the preponderance of men in the professions, psychology and psychiatry and so on. Do you think because of this, the definitions of normalcy, cure, treatment and so on are going to necessarily reflect a male bias?
Oh, there's no question about what they do, and it's a very destructive bias for the full potentiation of women. I brought with me, because I think it's always very interesting, a review of a paper of a study that's been going on for several years about what psychiatrists call ideal mental health in people. And that study has now, it's really a classic. And it shows that psychiatrists have the same stereotypes about women that the culture does. That is to say, they, rather than having the same standard of mental health for women and men, they have the traditional sex stereotypes. so that they expect men to be one thing and to call that mental health, and women to be another thing, which is quite disastrous, because clearly health is health. And what is good behavior and good mental feeling in a woman should be the same in a man, and vice versa. It isn't.
Well, how does psychology characterize a healthy woman, and how does this deviate from a healthy man?
Well, it's very interesting. What they did was to give a questionnaire, and this is what they concluded, and I think you'll find this as distressing as I did. They found, for example, that men were very aggressive, very independent, not at all emotional, very objective, not easily influenced, and of course the converse then is characteristic of women. Now remember that these are opinions that psychiatrists and other kinds of mental health therapists agreed that they had on an objective questionnaire. Women, on the other hand, are excitable in a minor crisis. They are passive. They are not at all competitive. They are very illogical. They are home-oriented. They are not skilled in business. They are sneaky. They do not know the way of the world. Their feelings are easily hurt. They are not at all adventurous. They have difficulty making decisions, etc., etc., etc. Now, in this study from which these conclusions were drawn, what they asked the clinicians to do was to give a picture. They asked one group to say, what is ideal mental health in an adult, without asking about sex of the person. In another group, they asked them, what is ideal mental health in an adult male? And a third group, they asked, what is ideal mental health in an adult female, using this standardized questionnaire. And what they found was that ideal mental health in an adult male is the same as ideal mental health in an adult. But ideal mental health in an adult female is a very different thing. And if a man acted according to the way they say a woman should, he would be regarded as sick. Now that is a very serious matter, because what it says is that if women take on qualities that are characteristically regarded as male, they are sick, and vice versa. And yet these qualities are really human qualities. To be adventurous is a human sort of thing. To be assertive or aggressive is a human behavior. And some of the qualities for women were very good. Just for example, they don't use harsh language, they are tactful, they are gentle, they are very aware of the feelings of others, they are religious, they are interested in their appearance, etc., etc. Now, those are good qualities for any kind of person. And it's, I think, criminal to socialize women to behave a certain way when they fail to meet these stereotyped standards and become emotionally uncomfortable enough to seek help. The therapist then says, well, really what's wrong with you is that you're rejecting your femininity, and you must try and be more feminine. You must accept your feminine role. And of course that's what drove her there very often in the first place.
So how is the acceptable norm for a woman to be established? Are you saying that a man cannot do this, a psychologist or a psychiatrist cannot do
I
this?
think women should be very wary of male therapists of any kind.
What about the female therapists in the field currently to date? Do you think they're just reflecting the teachings of their analysts?
Some are, some aren't. And some do in some ways and not in others. For example, my advice to women who are trying to see what kind of therapist would be good for them.
Exactly what I was going to ask.
Whether or not it's a woman or a man therapist, I think they may want to consider. But more importantly, I think they should ask questions like, how do you feel, doctor, about the feminist movement or the women's liberation movement? How has it affected your practice? In what way have you changed because of women's new and intense struggle for equality of opportunity in employment and so on? And if the therapist, whether or not it's a man or a woman, gives any sign of disapproving of this seeking after equality, or gives any sign of ridiculing of it, or criticism of the leaders, anything like that, I think, would make me really wary of that therapist's attitude toward women.
Well, can you shop around for a therapist?
Well, you certainly should.
You should be able to.
You should always shop for anything that you pay money for. I think you should make comparisons, although many, and that's another way of telling something about the person you're considering consulting, is how they respond to this kind of question.
Do you think men find it easier to throw off their sex stereotyping without regarding themselves as sick than women do?
I don't know. The socialization is very strong for both sexes.
Absolutely.
I think men recognize more quickly the disadvantages that women experience than women do. I have noticed that men get to the heart of the matter very quickly, whereas women keep trying to believe in what they've been taught to believe. I think it's in part because it's so dreadful to realize that you've been cheated, that you've been socialized into being half a person or less. And that's a hard thing to realize.
But can you legitimately blame psychiatrists and psychologists for this? Because as you were saying, they are reflecting the trends of society and the double standard, which is part and parcel of society.
I
So
do.
where does it all start? You do?
Yes. Oh, very, very much, because they ought to be at the forefront.
But I mean, can you blame them any more than, say, sociologists or educators?
Yes, I think so, because they have the best opportunity to reflect upon the ill effects of the rigidity of our socialization of males and females. And for them to perpetuate the evils of the system that Freud started is more serious.
Would you lay it all at the feet of Freud? Or is this
No.
an oversimplification?
I wouldn't lay it all there, but I'd take about 99% of it and that sort of. Yes, I think Freud has done great harm. There's no question but what he had some remarkable insights into the nature of human motivation. However, he said at the same time that he didn't know what women wanted, while he was defining the basic nature of their personality. And he said such things as, women are inherently inferior because they do not have a penis. Now that's an absurdity, and analysts are still perpetuating that. And when I get angry with psychiatrists and psychologists when they defend that absurd position and refuse to consider that it might be wrong. I don't say that everything that Freud said was wrong, but I am certain that everything that he said about women should be seriously questioned. And when psychiatrists and psychologists both, or either, refuse to question, that's when I think they are very, very, very wrong.
But there are certain noted psychologists that have questioned, namely Karen Horney and Adler to a certain extent, although it's not been very widely published.
Yes, that's an interesting point. I was a graduate student for a long time. 7 years I spent as a graduate student, and I never heard of Adler's position on women, which is one of the most enlightening and liberating for both women and men that ever has been, and yet it was never discussed. And incidentally, at a centennial of Adler's birth, where all of these Adlerian scholars came, and I asked about this, why wasn't that part of his work more widely known? They didn't know it. And the person that I cited the chapter in the page, and this individual had never heard of it. And he refused to accept that Adler had really made a big point of it.
It's extraordinary,
isn't it?
Well, do you think this whole type of psychology emphasizes and concentrates too much on who people are rather than getting to why they act this way from a sociological point of view and how they might act differently?
Yes. One of the problems I see with therapy for women and men is the notion that the trouble is inside the person, and that the person can cure their pain by being concerned. And too little concern with the damage that society does to individuals in various ways. I was very interested in hearing about Judge Bacon, who talked about child abuse and how to change parents, taking it one day at a time. She's looking at changing the situations rather than trying to change just the individual. And I think everybody should take that view. What is it about the way in which children are raised and the way in which society is organized that produces these behaviors? We must start to look to that.
Well, how can we as parents avoid putting a ceiling on our daughter's potential, and how can we, and our own, how can we get away from this without creating little social misfits that are going to be in a no man's land, rejected by boys, rejected by girls?
It's very hard. I come to conclusions about what to do by wondering how I would deal with the situation if I were a black parent in a white society, how I would socialize my child to stand up and not be oppressed by the racism of our society. Because I think we all are more familiar and recognize more readily how evil racism is. Now, sexism is a similar kind of thing. We don't worry any longer about teaching black children to be proud of being black, even though it may make them a social misfit, although parents used to. Similarly with little girls and boys, I think we have to run the risk that they will not be able to fit in. Maybe they shouldn't. Maybe society needs a lot of little social misfits. You know, children who will say, I don't like it the way it is and I'm going to change it.
Isn't this going to create a burden of guilt, though, if they feel that, well, motherhood is not for me, I'm not even interested in marriage, but this is what society says I ought to be interested in. These are
You
the
mean
norms
by
of
raising a
society.
child to be non-sexist,
Yes.
you might make it impossible for that child? Well, what happens to women who are raised to believe that they must be mothers and they have no interest in being mothers? I mean, that's what's happened to every woman. Every woman is raised to believe that her major objective in life is to be a mother. And I wonder how many human beings have been destroyed by that. I think it's time to raise people to be human beings who care about other human beings rather than to be all the things that we're now trying to raise them to be, like raise all the women to be mothers and all the men to be responsible economic wage earners. I'm sure there are many people who can't fit those two.
Right, sure. You're quoted as saying that psychology is only part of the problem. Now, what do you mean exactly by that?
Well, I didn't say only. What I said was psychology is part of the problem. And
I'm sorry.
Yes, there's a famous saying by Eldridge Cleaver who said that if you're not part of the solution, you're part of the problem. And that's why the only is not a good word in there. Psychology is part of the problem at the moment. It has not yet begun to be part, as a profession, it's not yet begun to be part of the solution. And I think there are rare individuals, rare still in their frequency, who are struggling very hard to change the nature of psychology. I belong to an association which I helped found called the Association for Women in Psychology that is really challenging the way therapy is done. The book by Phyllis Chesler is one outcome of that group. She was instrumental in helping to start it. There are other women who are writing and studying and doing scientific studies. For example, I maintain that we should not ever look at a study without knowing whether the person who did the study on the nature of women and men and their differences, without knowing the political position with respect to sexism that author has. Just as blacks have recognized that they have to be very wary of studies by whites that attempt to define what black people are, so feminists must learn to be very wary of studies by sexists which attempt to define what women and men are or ought to be. It's a political position to be a sexist or a racist, and we're more aware of the racist political position than we are at the moment of the sexist position. But women and some men are attempting to eliminate sex bias, just as blacks and some whites are attempting to eliminate race bias. To give you an example, there's a very famous study by Patrick Moynihan who claims that what's wrong with the black family is the pathology of black marriages and the matriarchy of black women. Now that is one of the most racist and sexist studies that's ever been done.
Yes.
It's from a white male point of view. People are now studying the difficulties that black people have that are due to living in a racist society. We have yet to have a similar kind of serious concern given to the problem of the difficulties that women and men have because they are raised in a sexist society where all men must be one kind of thing and all women must be the polar or complementary opposite. And yet maybe that's what's wrong with our society, or one of the major things.
Sure, it's one of the major parts. There's another study, nothing to do with sexism or racism, done by Martina Horner. I'm sure you're familiar with this.
Oh, yes. Oh, it does have a lot to do.
From Harvard University. Yes,
well, she's now president of Radcliffe. Did you know that?
No,
yes.
I didn't know that.
Yeah,
it's tremendous.
really great.
Yeah. But in which she sort of defines women's will to fail, or rather their avoidance of success. Do you have any thoughts on what really gives rise to this?
It's really a fear of success, because women, when they behave in ways that it is necessary to behave to be successful, are quite severely punished, although sometimes the punishment is psychological. For example, for a man to be successful, he must be very aggressive, and nobody thinks that that's a bad thing. But for a woman to be successful, she must not be aggressive, and yet you must be aggressive to succeed.
So that
puts you in a very difficult conflict. You either have to fail or you have to be something that nobody likes women to be. Now, some women who are usually very attractive looking and who are extremely clever managed to walk that very fine line between being just assertive enough to succeed, but not so assertive that people label you a bitch.
Mm-hmm.
But very few women can walk that narrow
Does
line.
it have anything to do with competition too? Because she drew some parallels. Boys and girls in grade school, it's about even IQ level. In college and in graduate school, the girls have dropped way behind the average boys. Now, does this mean that they can't stand the competition, or what? Is that an oversimplification, or what does it mean?
Well, the study that she did is a really fascinating one, and it's been repeated and replicated by many other people. And what she found was that when women were presented with what's called a projective test, it was a story about a woman who was a medical student who had come in at the top of her class, and they were asked to respond to that story. And in some cases, the story said Anne is at the top of her class, and she's in medical school, and other students were given John is at the top of the class, and they told very different stories depending on the sex of the person in this, in the projective test.
Right.
In each case, when the woman was successful, not in each case, but in a remarkably high proportion of cases, they rejected the possibility of success in a woman. They said such things as Anne was a composite character. The male students went together and wrote her test papers. There wasn't really any Anne. Mm-hmm. And they said such things as Anne is going to be a failure socially. She's going to be a very lonely doctor, and so on and so on. It's a tragedy to realize that women are encouraged to try to achieve, but if they are successful, are regarded as deviant.
Yeah.
And women recognize that, and that's what the fear of success is. The knowledge that if you succeed, you are a deviant person. If you fail, you are a failure, and there's no way to get out of that double bind for women.
Joanne, the time has flown. I've just seen the last time cue. Thank you very, very much. An extremely interesting conversation. We'll be back again next week. I hope you can join us then. Good night from Woman.